I'm Dr. Benjamin W. Weaver. I'm president and owner of Central Kansas Podiatry. Today we're going to talk about what people call heel pain. Heel pain can be an umbrella term for plantar fasciitis, Achilles tendonitis, or heel spur syndrome. We have some new technology here in our office today I want to talk about. It's called the butterfly ultrasound. So to give you an idea of what we're doing, if we take the standard foot, this is a left foot here, and we were to turn it over and use our ultrasound probe. What this does is send basically sound waves down and bounces off of the different tissue layers of the foot. When it hits bone, it turns bright white. When it hits fluid or other areas, it will be darker. So what I'd like to do today is show you a few images of what a normal heel would look like and what plantar fasciitis, heel pain, would actually look like. So when we're looking at the ultrasound, basically we're looking at the upside down of the heel. And I'm shining the ultrasound probe down here. What we're actually getting is the bottom of the heel, which is the white right here. Sometimes you'll get a heel spur and it will show a black shadow underneath here. But as you follow around the contour of the calcaneus, you can see the structures of the foot, what's going on. Here is the plantar fascial band. If you look at a normal one, normal sits around 3 to 3.5 millimeters. This patient over here, at their widest point, they were 6.4 millimeters wide. What I'm going to do is kind of pencil in some of the anatomy of the heel. This is the bottom of the calcaneus of the left foot. I'm drawing here in the white. Here in the red, I'm going to draw in the plantar fascial band. This fusiform shape right in here is actually the plantar fascial band. Being as thick as it is at 6.4 millimeters, that's indicative of plantar fasciitis. People say, what does heel pain look like? It looks exactly like this ultrasound. We're going to look at some different x-rays for patients that have heel pains. This patient here does have a little spur on the back of their heel and on the bottom of their heel. This bone right here is called the talus. And if we were to draw a line like this and bisect this bone, you notice we're below. Now let's blow up this heel and look at these spurs. You can follow this heel around and you can see this spur right here. It comes around and then you've got one right here on the back of the heel itself. Let me shrink this back down just a little bit, bring it back up. So up here, this is the gastrocnemius, or the calf muscle. That and the soleus muscle come together and they form the Achilles tendon. The Achilles tendon comes down, attaches to the back of the heel, sends fibers around here, and it makes the plantar fascial band, or the arch to the foot. On the outside of the bone is kind of a skin or a membrane called periosteum. And when the Achilles tendon blends into that and pulls on that skin or that periosteum long enough, you actually grow out a heel spur. What that tells me as a doctor is that you've been tight or have a quinus in those areas for quite some time. It takes a while to grow a spur because what you're doing is pulling on initial skin and it's actually causing a force to grow bone out. It's kind of like when you work hard, you get calluses on your hands. What the body's doing is trying to protect itself. So if we grow a spur out, what we're actually doing is shortening that band of tissue from here to here. So that spur is shortening or taking the strain off. Same way with the Achilles tendon. If we grow a spur here, we're kind of extending or giving a little step up to that Achilles tendon to take the pressure off of. So if we look at the anterior to posterior view, one of the big things I look at, the talus, this bone right here. If again we are to bisect that bone, you'll notice that we deviate to the big toe by quite a bit. The angulation of the talus should line up between the first and second toe. You can see that there's quite a variance going on here. When this talus internally rotates or goes outside the big toe, that's what's called pronation. Pronation is what causes heel pain because the whole We say medial column of the foot. So when we say medial column, this is the big toe all the way to these bones right here. This is the medial column. They internally rotate or flatten out. And people will walk around and they say they have a flat foot. Or my arch collapses. This is the area that changes or collapses in that area to cause foot pain. It puts a strain on that plantar fascial band that we're looking at in the ultrasound. Basically, it's straining that area, and with that strain causes the itis or the pain or inflammation that's caused to the plantar fascial band. Now, when you come see me, these are going to be the two main tests that we're going to do. Is going to be an x-ray and ultrasound to examine your foot pain. Hi, I'm Dr. Benjamin W. Weaver here at Central Kansas Podiatry. Today we talked about different causes of heel pain. You know, when we're looking at the heel, sometimes it's a spur, sometimes it's plantar fasciitis, sometimes it's the Achilles tendon. If you, your friends or family have any type of heel problems, please call our office. There's many modalities that we do have to treat these items with your foot. We have the most up-to-date technology to help diagnose your foot problems. Give us a call, and we're here to help. Thank you. Again, that's 316-269-FEET. You can also reach us at our website, www.ksfootdoc.com. If you guys are looking for us on social media, we can be found on Facebook, Instagram, and Twitter, all at KS Foot Doc.